Good morning, everyone. Myself, Twinkle Kalani. I am a licensed physical therapist and I have been working with the student as a one-on-one and the group classes and helping the students to pass their NPT exams with the flying color. So today's topic is multiple sclerosis. Let me share my screen. There we go. Let's start with the disclaimer. This class will follow the strict FSBPT and APTA security and safety regulation. Any group member posting the questions from the previous NPTA exam or even from the PEAT will be blocked. Content is created by the licensed physical therapy. It means it's me using a clinical expertise and textbook. So let's see what is the multiple sclerosis. Multiple sclerosis is the autoimmune disease inflammation of the selective demyelination and gliosis that affect the white matter. Okay, this is the definition. Now, what is the multiple sclerosis? So this is the autoimmune disease. Autoimmune means it affects my like immunity, like automatically it's affect my body, so my own body try to damage myself. That's called the autoimmune disease, and this is the inflammation of the selective demyelination and gliosis that affect the white matter. This is a chronic progressive demyelinating CNS system. CNS is the central nervous system. Central nervous systems, it includes the brain and spinal cord. It affects the brain and spinal cord. So this is the any area of the brain, the central nervous systems that affects the cortical, suborbital area, cerebellum, and the spinal cord. So let's review what is the MS and the definition try to means. So this is like a healthy neuron. Let's assume that you and me, we both are normal patient and our neurons is healthy. So what is the function of the neuron? Neuron function is to send the signals to our brain. So let's see, this is the dendria. Okay, and this is the main neurons, and the neurons is the sending the signals to our brain. So it's, let's see, if someone tried to touch me, the sensation and all this information is transferring like this way, zoop 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 zoop, and it's like one neuron sending the signals to the other one, and then another one sending the signals to the other one. So it's like the neurons, one neuron sending the signals to the another one, and all this way the all the information reach to my brain. So this is basically the transmission of the neurons and what is the function of the neuron. But in the MS patient, on the next picture, this is says the nerve affected by MS. So in this one, the because of the myelin is damaged, the signals is not reaching to the brain on time. So let's see, this is the zoop, then here is the damage one, then again zoop, damage, zoop, damage. So you will see it takes a longer than expected to reach all the information, all these signals reaching to my brain. So that's basically the definition means. Age is 20 to 40 years of the age, 30 years is the peak age. Female is more common than the men, and UMN presentation. UMN presentation means upper motor neuron. Upper motor neuron means the, like, that's a presentation when the tone is increased, reflex is increased. So you will see the UMN presentation when the tone and reflex is the increase, and that's mainly affects the central nervous system. Here the patients have a mixed sensory as well as motor affection. Now, this is just the diagnostic things, mainly the MRI, CSF analysis, and the evoke potential. So in the MRI, we can see the two separate lesion in the central nervous system. And then CSF is nothing, it's just the elevated immunoglobulins and the present of the oligoclonal IgG bands, and the slightly protein is elevated. I'm gonna talk about further which protein is affected in the MS, so just hang in there. The evoke potential, because of the sensation is affected, we will see the decreased nerve conduction velocity. Now, the most important thing is the type of the MS. I've seen the students making so many different mistakes in this one. Sometimes they understand the type, but they don't know how to apply on the question. And sometimes, like, okay, the word is like, a little bit hard, so it's tough for some students. So let's make it simple as possible and make our question right. Okay, let me share my whiteboard and we will discuss all the types of the multiple sclerosis. Okay. So this is the type. Let's start with the first type. The first type is the relapsing remitting MS. Relapsing remitting MS is the first type of the MS. Now, for easy, I'm just gonna replace some word for you. So let's try to make it simple as we can. So relapse means, now let's replace the relapse means slap. Okay, if somebody slap us, is it a good or bad? Of course it's bad, right? Like, okay, oh my gosh, yeah, this person slapped, so yeah, that's the very bad period. Whereas the remission or remitting, you can think about a remission period, which is a good period. So in short, this is a good bad period. So let me show you the graph. This is the graph, and then relapse means the slap. So slap means bad. When my symptoms is increased, then remission is good when the symptom is decreased. So, and then there is a no symptoms. Then again, bad, good, no symptoms. Bad, good, no symptoms. So this is the first type, and this is the relapsing, remitting kind of the multiple sclerosis. Now, the second type is the primary progressive MS. So primary means at the starting, right? Starting point. You can think about it like a starting, primary, beginning, and then progressive means getting worse and worse. Okay, so basically this type, it says that from the starting it's getting worse and worse. So this is, let's draw it out. So this is a from starting point, it's getting worse and worse. So this is the primary progressive multiple sclerosis. Now let's discuss the next one. The next one, don't worry, I have a question as well. So I will show you how to solve this question. Okay, so just don't worry at all. Let's try to understand first the type. And the third is the secondary progressive. So secondary means second half. And progressive means again worsening. So now the second half is getting worse. So I remember like this way. This is the combination. This is my combo of relapsing, remitting, and primary progressive. This is the combination of the relapsing, remitting, and primary progressive. Why I say this is the combo? Because let's draw it out the graph. So secondary means the second half is getting worse. So this is the second half getting worse. Then what is the primary half? Primary part is like this way. So getting symptoms getting worse, then better, then no symptoms. Then again, worse, better, no symptoms. Worsening, better, and then no symptoms. So look at this. This is a first part, and this is the second one. Can I say this is the combination of the relapsing, remitting, and primary progressive? Right? So that's how I just remember. Now, the next one, let's draw it out. The last one, and that's the progressive relapsing. So let's break it down. Progressive means worse, And the relapsing means slap. So slap means again bad period. So this is the getting worse, and on the top of it, the patients have a slap episode. Slap episode, you can think about the acute attacks as well. There are some different word terminologies they can use. So yeah, relapsing is like nothing, it's just the slap bad period and then acute attack. So let's draw it out, the last one, which is the patient is getting worse, so progressing the disease, and on the top of it there are some acute attacks. So this is like slap slap slap. I think about it like, let's see, this is if someone slap us continuously, is it a good idea? Not really, right? It's a very bad. So that's why this is the worst type of the MS, and only the 10% of the population have this MS. The 10% of the population have this, that's the progressive relapsing. Which one is the most common type? The most common type is the relapsing remitting. This is more, almost 80% population have this relapsing remitting type of the multiple sclerosis. Okay, so far all these four types good to go. Yeah, try to break down the words when the concept or some stuff does not make sense. Try to break it down and make it as simple as possible. So let me share my screen and we will go over again all. We already went all this type. There is a one more type, that's the 2013 MS disease. Back in the days, like before 2024, they mainly focus on 1996 MS classification, but starting from the 2024, they are focusing on the one more type, which is a clinically isolated syndrome. This is the one type they added in Sullivan, and this is the clinically isolated syndrome. It's a very simple type, is like the patients in the entire life only the one attack of the MS, and after that it's never comes back. So this is the only one attack of the MS in entire life, and then after that the patient does not have any attack. That's called the clinically isolated syndrome. This is the fifth type, you can think about it. So in the newer editions, they remove progressive relapsing, but they add the clinically isolated syndrome. I would suggest to focus on all five, because we never know, right? Let's see that maybe probably just in case if you see somewhere in options, you can easily eliminate the other one. So anyways, this is just simple. Just remember, these are the main five types of the MS. Okay, this is the question for you. Just I'll give you a 1.5 minutes to solve this question and then I'll tell you the answer. Okay, your timer starts now. Okay, let's discuss 42 years female arrived to the outpatient PT clinic for the management of the frequent falls at home due to the muscles weakness. Upon eval, the patient state that she has a history of MS and described that the symptoms usually aggravates at the intervals with the presence of the continuous decline. Which type is it? Okay, so let's draw it out the graph together. So patient says that aggravates at the interval with the presence of continuous decline. So continuous decline means getting worse and worse. That means decline, and then aggravates at the interval. Interval means the slap period, or you can say the acute attacks. So this is the all are the attacks. All right. So now which type is it? As we just said, discussed before, this is the progressive relapsing multiple sclerosis. Because the progressive relapsing is the progressive means worsening and relapse means slap period. So slap means the acute attacks, or you can say the intervals. So correct answer is number D. Good job, everyone. Okay, don't worry, I have a second question as well. So let's solve this. Always draw it out. Use the pen and pencil, so that way you can easily correlate the information and draw it out quickly the graph. Trust me, you never ever go wrong when you use the pen and pencil and try to draw out the stuff. You will never ever go wrong. So trust the process, and yep, D is correct answer. Question number 2. I'll give you again 1 minute and let's do it. Few more seconds to go. Okay, let's discuss. 52 years old female history of the MS and describe that the symptoms initially would appear for few days and disappear within week. Okay, so symptoms is appear for few days and disappear. So let's draw it out. Appears, disappear. Okay. And the patient experiencing the partial recovery and stable symptoms between her periods of attack. Okay, so now the symptoms are stable. Then again, it appears for few days, disappear the symptoms, and then stable symptoms. Appear, disappear, stable symptoms. Appear the symptoms, disappear, and stable symptoms. So this is which type is it? This is the relapsing remitting. Yes, the relapse means a slap, which is a bad period, and then remission, which is a good period. So good, bad, and then the middle, the symptoms are more stable. Yes, so this is the correct answer is again number D. And good job, everyone. Okay, let's move on to the signs and symptoms of the multiple sclerosis. So the pain is the chronic neuropathic pain. And the one is the Lermite sign. What is the Lermite sign? Lermite, I just remember a little bit differently. Lermite is a hair become messy. Okay, so why the hair is messy? Let's see. What is a Lermite sign? Lermite sign is it says that when the patient do the neck flexion, they have an electrical shock like sensation in the extremity. Exactly, you can see in this picture. Patient is in the neck flexion and they have an electrical shock like sensation. I remember like this way when I do neck flexion, right, my hair become messy, right? You can see on the picture clearly that my hair are messy. So that's the Lermite sign. Let's try to break it down. This is just a funny way, silly way to remember, so that way at least you can remember for all this information in the exam. Informations are a lot, so let's try to remember through the mnemonics, through some stories, break down the words and make our life as simple as possible. So, what's the treatment? As a PT, what is my job? My job is to give them a soft collar so that way they don't do the neck flexion. Hyperpathic headache. Increase is just nothing to increase the perceptions of the pain. Motor is the spasticity of a motor neuron. So here the tone is increased. Reflex is also increased. Now, some sensory symptoms is the tingling, numbness, paresthesia, trigeminal neuralgia, which is a cranial nerve 5. In cranial nerve 5, only the sensory branch affected. Sensory branch are MOM, maxillary, mandibular, and O is the ophthalmic. So here only the two is affected, which are the maxillary and the mandibular. No O. O does not is affected. That's the ophthalmic nerve. Okay, so that's not affected. Only MM affected, which is a maxillary and mandibular. I remember the MOM, right? The MOM is this three branch maxillary this is a mandibular, this is a maxillary, and then top one is ophthalmic. So ophthalmic, maxillary, and last one is mandibular. So that's the more branches, only maxillary and mandibular affected because of the cranial nerve. Fine. Now the next thing is there are some few extra symptoms related to the vision, blurred vision, diplopia. Diplopia means double vision. Okay, diplopia is nothing. That's the double vision. Dismiss acuity. Acuity means the clarity. Clarity is affected. Clarity is like, sometimes we will see like some people are more nearsightedness, some are more farsightedness. They can see near, but they cannot see the far. Farsightedness means they can see the far things, but not able to, read and look at from the computer and phone. So that's the farsightedness. Optic neuritis, which is a cranial nerve. Two, optic nerve is a cranial nerve too. So here that optic nerve is also affected. Nystagmus scrotoma. What is the scrotoma? Scrotoma is just nothing. It's a dark spot in the central of the visual field. That's the scrotoma. Let me just put it here, just as if you don't know what is a scrotoma means. That's a dark spot in central of visual field. Then lateral gaze palsy. What is the lateral gaze palsy? It means the eye is not able to go out laterally. It means this is because of the which cranial nerve is affected here? The cranial nerve 6, right? What is the function of the cranial nerve 6? My patient is not able to look at outside laterally, which is a cranial nerve 6. So that's called the lateral gaze palsy. Marcus gun pupil. What is a Marcus gun pupil? Marcus gun pupil is that's a normal. Let me show you the what is a normal response. Normal response is let me show if you show on the light, what happens? The pupils is which is inside the eye. You will see the spot here. They try to constrict. That's a normal response. But in the MS patient, the pupils rather than constriction, it's dilate. Okay, I'm showing you my eyes, but eyes is not opening and closing. The pupils is constriction and dilation happens, but I'm showing you my eyes so you can see what's going on. So when you see the light, rather than constriction, the MS patients dilate the eye. That's called the Marcus gun pupil. How I remember? I remember like that. Let's see the Marcus is a person, okay? Again, if your name is Marcus, please don't take it seriously. This is just make it easy, so at least we remember some terminologies. Let's see the Marcus is show you the gun. What we say is like, oops, our eyes are wider, so that's the more dilated pupils. It's the Marcus gun pupil. Dilation in both eyes, so that's the Marcus gun pupil. And the last one is the intranuclear ophthalmoplegia. Intranuclear ophthalmoplegia is the one eye does not move. It means, let's see, if the right side, if you give the command, look up, down, out, in, right, the another eye is not able to follow it. So one eye does not move, and the patients have a loss of conjugate gaze, which is the what is the loss of the conjugate gaze? Loss of conjugate gaze is nothing. It's just the contralateral cranial nerve 6, and then ipsilateral cranial nerve 3 is affected. That's called the loss of conjugate gaze. Again, this is the terminology. Yes, you have to remember what it means. Okay, so intranuclear ophthalmoplegia is like the eyes does not, follow with the other eyes. And loss of conjugate gaze is the contralateral side cranial nerve 6 is affected and the ipsilateral side cranial nerve 3 is affected. That's the conjugate gaze. Now, some other key features, the fatigue is always there. The patient's always tired. The MS patient, this is like the fatigue is always there in MS patient. Majority of the neuro conditions, yes, fatigue is the main, they're always because of, the brain stress and all these things going on. So yeah, fatigue is there. Elevated gamma globulin. What is the gamma globulin? Gamma globulin is a protein in the MS. So that's a protein in the MS. That's a gamma globulin, cranial nerve affected, which is a 9, 10, and 12. Let's see the cranial nerve 9. Cranial nerve 9 is the dysphagia. Dysphagia means the patient has a difficulty swallowing. Then cranial nerve 10, that's the dysphonia, phonation, which is a cranial nerve 10. And then dysarthria, 3D, cranial nerve 12. That's the patient is difficulty speech. That's the cranial nerve 12. Okay. So 3D is present, cranial nerve 9, 10, and 12. Cerebellum. In the cerebellum, the Charcot triad, the SIN. What is the SIN? SIN is the scanning speech, intentional tremor, and nystagmus. Triad means three things affected. Okay, so that's the SIN, and SIN is the scanning speech, intentional tremor, and nystagmus. And also, there are some other features because of the cerebellum is affected here. We'll see the coordination difficulty, balance problem, ataxia, intentional tremor. Intentional tremor means when I try to intentionally move my hand, I have a tremor. That's called the intentional tremor. There are two types of the tremor. One is resting tremor. Resting tremor means when I rest, during that time I have a tremor. That's called the resting tremor. It's mainly present in Parkinson's. Intentional tremor, when I intentionally move my hand, that's present in MS. Gait is scissoring gait. Scissoring means because of the adductor spasticity. Hip adductor spasticity, scissoring gait, extensor spasticity in the lower extremity, ataxia, and uneven step. Bladder is the spastic as well as the flaccid bladder. Again, depends on the patient to patient. Some have a spastic, some is a flaccid. And mixed urinary incontinence, urge and overflow. Mixed is in MS. Speech and swallowing difficulty, as we said, cranial nerve 9, 10, and 12, dysphagia, dysphonia, dysarthria. Emotional is the pseudobulbar effect. What is the pseudobulbar effect? Pseudobulbar effect is nothing, is the emotional incontinence when the person is either laugh or either cry for no reason. That's called the pseudobulbar effect. Cognition, diminished attention, concentration, memory, higher executive function, judgmental problem solving is affected, and euphoria. Euphoria is happiness is also affected. And that's why you can see in this picture, this is a pseudobulbar effect. This is like patient is either laughing or crying for no reason. And euphoria means happiness is affected. If someone takes our happiness, we are like always sad, right? So that's the euphoria. Okay. Practice question number 3. Few more seconds. Okay, let's discuss. 40 years old female patient with MS present with electrical shock like sensation that runs down to the spine into the lower extremity, secondary to the neck flexion. Is it suspected that there is a posterior column is damaged? In the patient, clinical presentation may be described as. Okay, so we all know, we as we discussed before, this is a Lermite sign. This Lermite means hair messy. When we do our neck flexion, patients have a electrical shock like sensation. So what's the treatment? The treatment is cervical collar, right? Cervical collar. As a PT, we can give the cervical collar. So, yep, answer looks A, correct to me. But let's read the B. Uthoff syndrome. UTOF syndrome is nothing. The patient is a heat intolerance. Heat intolerance. And I remember U means U, T means turn, heat, H means heat, and off means off. Can you please turn off the heat? Why? Because this patient are heat intolerance. The intranuclear ophthalmoplegia means the patient is unable to move the one eye. So what's the an anesthesia is just the anesthesia. So what's the correct answer? It's number A, Lermite sign. Okay. All right. Let's go to the next page, which is the relapse means the exacerbations. What is the slap? As we said, slap, relapse, right? Slap is bad. So that's the attack, bad period, which is a last more than 24 hours. And in this one, the previous attack and also the patient is getting the newer attack in the brain. It's because of stress. So, what's our PT job? Our job is to refer the patient to the physician. Remission period is the good period, but the slap period, the bad period, right? Relapse, slap, exacerbations period. So, which is last more than 24, and make sure your job is to refer the patient out. Next is UTOF. As I just said before, U means U. Let's again review it. T means turn, H means heat, and off means off. U turn heat off, which is a UTOFs. U turn, T is a turn, H is a hot, heat, and off means hot, off. U turn heat off, which is a pseudo exacerbation. Pseudo means a fake exacerbations. Why it's fake? Because it's just the temporary worsening, which is less than 24 hours, same symptoms, but here it's because of the heat. So when the patient call, make sure you call them for the therapy. When the patient complains that yesterday I went to the beach and now today it's my all the symptoms coming back. So you can say it's okay, no worries, this is just the temporary worsening. It's okay, you can come for the therapy. And education is the most important. Make sure you tell them what is the heat intolerance. Make sure you go outside. Even if you go out, like you can use the umbrella or you can use the like a cold jackets which is available online. You can buy them, purchase it, and then you can go out by wearing the cold jacket, use the umbrella, so directly all these symptoms not coming back easily, and show them the lower intensity exercise. Now let's review the intervention. Intervention, which is a very important because here the clinical roles, right? We play our role. If the patients have a pain, make sure you will give the TENS therapy. Do not over fatigue. This is a very, very important things to know. I seen like for example, if we are working in outpatient clinic, we actually like push the patient that you can do this, let's lift this pound and this and that. But if the patient have a neuro condition, this is like more majority of the part. Whereas MS, GBS, Parkinson's, we will do one by one all of this so you can correlate as well. Make sure you will not over fatigue this patient. So we will use the distributed practice. What is a distributed practice? When the rest period is more than the practice time. When the rest period is more than the practice time, that's called the distributed practice. And one is the massed practice. Mass practice is exactly opposite, which is here the practice time is more than the rest time. I'm hoping that you all are doing the mass practice for the studying NPTE. Okay, make sure you study more and rest a little bit less. So that's called the mass. But MS patients have the distributed. We use the distributed practice. That's which means rest time is more than the practice time. Never exercise to the point of fatigue. Manage the overheating program by educating the patient. Make sure you Room temperature is appropriate for the patient. Aquatic therapy, you can do it, but make sure the temperature is not more than 85 degrees Fahrenheit. Energy conservation, make sure they manage the fatigue diary, activity pacing. Exercise is the best in the morning. Include the coordination exercise, balance, because the patient's cerebellum is affected. Training, proper training. Spasticity is the main medication for the spasticity is the baclofen. Why you need to know all this medication? Because as a PT, our job is to like work like according to the when, like for example, let me explain through the example. Let's say the patient is taking the baclofen at 9 a.m. in the morning, so make sure you schedule the session 10 a.m. Why? Because after 1 hour the medication is working in the patient's body, so they can, you can easily work. That's the reason we need to know the medication's name and all the information about it. Now, the fit principle. Let's review the fit principles. First is the frequency. 3 to 5 times a week. Make sure we pick alternating days, morning if possible. I is the intensity, low intensity exercise, 3 to 5 METs and 50 to 70% VO2 max. Time is the 30 minutes per session, and type cycling, walking, swimming, and circuit training may be the best. So that's the fit principles and intervention of the MS. Still, it again, we treat the patient according to their symptoms. Let's see the patients have the ataxia. Make sure we use the rollating walker. Coordination exercise is a Frankel exercise. Let's see patients have a coordination problem. You'll do the Frankel exercise. Energy conservation, and if the patients have a foot drop, we will use A4. A4 is the ankle foot orthosis. But please don't use the KFO. Why not KFO? Because the KFOs are more bulky, right? A4 is not that bulky, so you can use the A4 if the patients have a foot drop, but please don't use the KFO. If the patients have a dysphagia, means the swallowing difficulty, right? We try to prevent the aspirations by using the semi-solid food. If it's the and the liquids are more viscous, thick, so it's a warm food, semi-solid food, and liquids are more thick and viscous. Practice question number 4. Few more seconds. Which of the following exercise program is the most appropriate for 67 years old postpartum female patient with MS who has a poor balance and decreased strength? Okay, so what's the main priority? Main priority is patient has a poor balance and decreased the strength. Whenever you pick the answer, make sure you focus on their difficulty. What's the difficulty? Here is the balance problem and the strength is decreased. So pick the answer according to the balance and strength. Option number A, stretching, posture, balance program, yes, and then strengthening exercise as tolerated. So yes, both problem, balance and strength, is covered in option A, which seems good to me. But let's mark it here and review the next one. Stretching, yes. Progressive heel training on the treadmill. Yes, we'll do low intensity exercise, not the high. So I don't like the heel training. You can walk on the treadmills, but not here. The reason is because my patient has a balance problem. So I cannot tell my patient to walk on treadmills because of the poor balance. Warm water aquatic training, again they are heat intolerance, right? UTOFs, as I said, the UTOFs phenomenon. So I will not use the warm water aquatic therapy. And the progressive heel training on the treadmill with the plyometric training. Again, treadmill is not a good idea because of the balance affected. And the plyometric training is also not the good idea because it's more high intensity exercise. I'll mainly focus on the lower intensity exercise. So correct answer is looks A correct to me. Okay, I'll just put the answer here. It's A. Okay, let's do the question number 5. Few more seconds. Which of the following intervention is the most appropriate for the individual who has the multiple sclerosis? Submaximal exercise performed in the morning. Yes, morning exercise is the best. Looks correct to me. Heated indoor pool. Nope. This is a patient. My patients are heat intolerant. So that's the UTOF. I'm going to avoid that. So B is out. C. Resistance exercise alternating each day between the upper and lower extremity workout. Again, resistance training. No, I would try to avoid it. And because there again the fatigue is my biggest problem here, right? So I will try to avoid the resistance training, strength training, maximum exercise to the point of the fatigue with several days of the rest between the training session. Again, fatigue is the problem. Can you do that to the point of the fatigue exercise? No, we tell the patient to manage the fatigue diary, right? So fatigue is the biggest problem, not to the point of the fatigue. So what's the correct answer? Correct answer is number 1. Case scenario. Uh, let's review it. Then I will give you one by one all these 3 questions and we will discuss it later. Your time starts. First, solve all three together. We will discuss it later. Few more seconds. Next one. Few more seconds. Next one. Few more seconds. Okay, let's discuss the scenario. Let's review it first. Patient is outpatient settings, 38 years old. Current problem, weird sensation in the body, frequent fall, difficulty with urination. Family history, the mother has migraine. On eval, active and passive range of motion grossly intact. Gait is slightly wide base of support. Tone is increased. Specifically the biceps, hamstring, and the plantar flexion. The cranial nerves 2, 3, 5, and 7 involved. Coordination impaired, and the other information teachers at the local school and has to constantly stand and sit for the period of the time. Okay, so question number first is an exercise session that includes the 5 minutes of the continuous practice and the 25 minutes of the rest. Best represent which of the following practice? Okay, option A, mass. Let's review what is the mass practice. Mass practice means when the practice time is more than the rest time. That's called the mass. You all are, I'm assuming you, hopefully, you all are doing mass practice, studying more than the actual rest. Distributed is exactly opposite when the rest time is more than the practice time, which is distributed practice. Blocked means same thing again and again. It means that, for example, 111, then 222, then 333. That's called the block, same thing again and again. And then random means randomization. Random means like 1, 3, 2, 4, 2, 1, 3, 2, 1, something like that. That's called the random. So here the 5 minutes continuous practice and 25 minutes of the rest. That's the 25 minutes rest, which is more, and then 5 minutes is actual practice. So rest time is more than the practice time, which is, what's the correct answer? Answer number 2 is correct, which is a distributed practice. Answer is 2. Distributed practice is the rest time is more than the practice time. And I told you to remember rest time has a R in it. So R reminds me the rest is more than actual practice. So correct answer is number 2 for the 6.1 practice questions. Now next one is 6.2 case scenario. The PT decided to assess the patient's pupillary reflex on shining the light into the patient's left eye. Both pupil constrict. Okay. However, on shining the light on the patient's right eye, both pupils paradoxically dilate. So which side is affected? Of course, the right side, because the right side is dilate. The normal response is the left side. Normal is the left is normal because they say is the constrict on the both the pupils. So left side is normal. The right side is affected. Which of the following is most likely diagnosis and cause of this presentation? So looks, that's the Marcus Gunn's pupil for me, like, because I told you to remember, like, let's see, the Marcus is shown the light on your eyes rather than you constrict, you dilate, right? That was the things we remember, the Marcus Gunn pupil. Now which side? Okay, so lesion on the right side, cranial nerve 2 looks correct to me, because the sensation, when the cranial nerve 2 is responsible for sensation, when they are not able to sense the light signals, rather than constriction, they just dilate, right? So A looks correct to me. B, cataract. Is it the cataract? No, it's not a cataract. So B and C, I'm gonna rule out. And is it the left side affected? No, it's the right side is affected. So correct answer for question number 2 is A. Yeah, sometimes I type super fast, so my spellings are a little bit off. So please pardon me for that. Answer is 2. Number 3. Which of the following is the most appropriate recommendation for this patient? Exercise sensation should be scheduled the same time every day in the evening for consistency. Not evening, I said morning is the best. So A is ruled out. B. Rest break and the activity pacing should be incorporated based on the patient's symptoms, which looks correct to me. During the pool therapy, the temperature of the water should be 87. No, less than 85 degree Fahrenheit. So C ruled out. And number D, balance and proprioceptive straining must be avoided to prevent a falls during the rehabilitation. No, my patient's balance is affected, so make sure you will teach some balance exercise, coordination exercise, right? So answer number D is also out. So what's my correct answer? Correct answer is number 2. Okay, now let's solve this question. Few more seconds. PT works with the patient on the proprioceptives and balance activity due to the recent fall. The patient informs the PT that they have recently been diagnosed with optic neuritis, which is the optic nerve, cranial nerve. 2. Which of the following medical conditions should the PTs most suspect might be the cause of the patient's clinical presentation? What's the correct answer? Looks D correct to me because that's one we uh, review it, right? The few slides back, I told you the cranial nerve 2, which is affected, and that's the Marcus gun pupil, right? Marcus gun pupil. Rather than constrictions, if the pupils dilate, that's the cranial nerve 2 affected, which is the optic neuritis vision problem, and all these things. D is correct answer. Good job, everyone. Last question of the day. Finish strong, okay? This is the last question, and you know one of the most important favorite topic for the exam, which was the MS. So, congratulations to all. This is the last question. Let's do it. Few more seconds. Okay, let's discuss. 35 years old female with MS present to the clinic with the exacerbations of her symptoms after completing the prolonged exercise routine in the morning. She currently experiencing the diplopia, dysesthesia in her lower extremity, and excessive fatigue. Her medical chart reveals the note that the patients have a cerebellar involved of the MS. Which of the following is the least likely associated with the patient? Option A, dysdiagochokinesia. What is the dysdiagochokinesia? Is the patient is unable to rapidly alternating movement. Patient is not able to move the arm rapidly in alternating movement. For example, supination and pronation. My patient is not able to move the rapid alternating movement. That's called the dysdiagochokinesia. Headache, nystagmus, and the external cold stressor bringing about the pseudo exacerbation. Which one is the least likely? So dysdiagochokinesia is over there, so that's out. That's most likely. Headache, yes. Nystagmus, yes. External cold stressor, no, it's the heat, right? They're heat intolerance, not a cold intolerance. So the answer is number D. Least likely answer is number D as in dog. So, congratulations to you all. You finished the one big topic, which is the multiple sclerosis, is the highly important. I would suggest to please review it before your PTA or PT exam, both of the exams. There is a favorite topic. And thanks for joining the class today. If you have any question, feel free to reach out. This is my email ID and this is my phone number. Okay, and we will see you next time with the again important topic for the exam. And goodbye for now. If you have any question, feel free to reach out. And have a wonderful day. Bye bye.